My name is Michael Devon, and today I will be discussing the Ebola outbreak in Liberia compared to the United States. Liberia is one of the three countries in Africa that was hit the hardest by the Ebola virus. The initial response to the outbreak failed because teams were unprepared and did not respond rapidly or effectively. The virus spread easily through Africa because Ebola hit the big cities. The West African countries have a dangerous lack of doctors, nurses, laboratories, and supplies, and it was difficult to convince people to put a halt to the tradition of washing their dead relatives before burial. Spread the virus. Ebola was a swift killer. Of the 10,500 people who contracted the disease in Liberia, 4,700 died. Cases of Ebola spreading in Africa, it was only a matter of time before the virus was transmitted to people traveling internationally, thus bringing the virus back with them overseas. The international spread of Ebola caused global media conglomerates to become involved in the coverage, and what was once a local issue became a global concern. The issue of Ebola was heard worldwide at the peak of the virus, mostly due to the transmission from Africa and other countries around the globe. Prior to Ebola spreading internationally, Liberia and the rest of Africa was left to handle the problem. It was not until Ebola hit the United States that the World Health Organization and Center for Disease Control become involved. For a brief moment in the span of the Ebola crisis, developmental journalism began to take effect because Ebola became a global issue. Developmental journalism served to promote the needs of developing countries, and it assumes that everyone, including the local media, needs to work in unison to support national goals. During this time, the focus of the mainstream media was concentrated on what was happening in Liberia and what needed to be done to help prevent further damage from the disease. This technique worked, and Ebola was on the decline internationally. However, in Liberia, Ebola was still present. The World Health Organization finally declared Liberia free of Ebola on May 9, 2015. Yet, in early July 2015, a new case of Ebola was reported in Liberia. Most of the world is not aware of the continuing presence of Ebola in Liberia, and the world systems theory explains why. World system theory states that global economic expansions takes place from a relatively small group of core zone nation states out to two other zones of nation states, these being in the semi-peripheral zone and the peripheral zone. The core nations hold the power in the world system, and this explains why the rest of the world is not fully aware of the ongoing problem with Ebola, simply because it is not affecting them anymore. The United States no longer finds it relevant to cover the Ebola story because there are no new cases in any other parts of the world except Africa. According to McPhail, peripheral nations have high rates of health problems and the fewest news stories written or broadcast about them. Most of the time, there is nothing interesting about a third world nation, and therefore media coverage is minimal and concentrated on issues that affect the rest of the world. Based on my research, I would like to find out why international media coverage halts on a specific local issue that at one time impacted the entire world, but has not fully gone away in other parts of the world. 10 sources in total were used to complete this project and grasp an understanding on the key differences in representing the issue of Ebola from different sources of media. The United States sources were from articles and reports made by CNN, and a local Liberian newspaper called the Inquirer News provided the sources for media coverage in Liberia. My main focus throughout this project is how media coverage differs in peripheral nations and core nations, and what points the different media address in regards to the specific issue. After looking through articles, it was clear that I needed to cover whether the coverage in the United States as well as Liberia was biased or neutral. I came to the conclusion that both sides are exceedingly biased. According to CNN News, Ebola was declared dead in Liberia, although you can clearly see on the map that Liberia is still active with cases of Ebola. According to the Inquirer News, although Liberia has lost their Ebola-free status, Dr. Bernice Dawn, the Minister of Health, says there's no need to panic. According to CNN, Ebola was originally declared dead by the World Health Organization in May 2015, but the WHO said that Liberia must be vigilant for signs of reintroduction. It is easy for a country to dismiss the warnings of health experts when Ebola was reported to be on the decline, according to CNN back in October of 2014. The virus has the potential to appear in waves, which can be mistaken for declining cases. Although the virus seemed to be declining, the more likely scenario was a break in the wave, which led to people mistakenly letting their guard down, causing them to be more susceptible to the virus and how quickly it spread. According to the Inquirer News, the chief medical officer of the Ministry of Health, Dr. Francis Ketter, pointed out that in order to stop the spread of the Ebola virus, Liberians must seriously adhere to all the necessary Ebola preventative measures. The Inquirer News interviewed a Cuban diplomat, Pedro Gonzalez, who was tasked to help Liberia during the onset of the health crisis. Gonzalez said, "The best way out is for Liberians to be disciplined, especially on the issue of preventative measures to avoid the spread of the disease." As you can see, this table highlights the do's and don'ts for preventing Ebola. The economy in Liberia has suffered dramatically, causing nearly half of the workforce to quit working. CNN's African Startup reached out to workers, entrepreneurs, and business people in Liberia to find out how they're dealing with the crisis. Harris Colley, a motorbike taxi driver, said people don't want to ride with us because they are afraid of the transmission of the disease. Colley told CNN, "Before the outbreak, we used to transport 30 to 40 people a day. Now, because of the closure of schools and businesses, we might transport 20 people in a day." The Liberian economy is in a catch-22. Until the Ebola virus is completely gone because they cannot work in fear that they will catch the disease. Efforts to stop the progression of the disease have been undertaken by organizations like the Peace Corps, the Liberian Red Cross, and the World Food Program. According to CNN, the Peace Corps have been serving as the foot soldiers on the health crisis because they have the most rapport with the residents of Liberia. The Peace Corps staff help CDC experts build local support in the affected areas, bridge gaps in logistics, and facilitate community entry in culturally appropriate ways. Since many of the CDC officials have never actually been to Africa, the Peace Corps use their good standing in Liberian communities to assist the CDC in getting prevention and treatment messages to the most effective stakeholders in each community. The Peace Corps paved the way for the further efforts to be effective at combating the progression of the disease. According to my source in Liberia, the Inquirer News, the Liberia National Red Cross Society donated 500 hand-washing Ebola buckets, 4 containers of chlorine, and 50 pieces of thermometers, intended to help the people practice the preventative measures. According to the Inquirer News, the World Food Program mobilized quickly to deliver 46 metric tons of food, rice, pulses, vegetable oil, salt, and nutritious corn-soya blend, enough to meet families' food needs for 1 month. The food will help to contain any possible spread of the Ebola virus by ensuring that people do not have to leave their homes to find food. The actions from the Peace Corps, the Red Cross, and the World Food Program are necessary to help rebuild the country from the devastating outcome of the disease. Although the rest of the world declared that Ebola scare to be over, local news sources in Liberia showed just how far the disease has progressed, leaving a staggering death toll in its trail. Though Ebola is still present in Liberia, the proper precautions are being taken to avoid further advancement of the disease as experts are scrambling for a cure. The coverage of Ebola by local media in Liberia and the United States approach the issue from different perspectives. The United States focuses on how it affects Americans, and since it does not directly affect them, they find no need to cover it because it is not what the people want. Liberia approaches the issue through a matter of well-being for their people and others around the world by showing through the media that the issue is still very much alive and has the potential to affect the world again if it is ignored. Developmental journalism theory is relevant for this study because the news covering Ebola has been on the decline in mass media. Only after studying local sources in Liberia did I find current information on Ebola and updates on the status of the disease. World system theory also explains why there is not detailed coverage on Ebola in Liberia because it is a peripheral nation. The development of some nations and not others causes some to fall behind, specifically in terms of usage and technology. The lack of television, internet, and other forms of technology in Liberia caused the rest of the world to overlook events taking place in Liberia that could potentially impact the rest of the world. In the case of Ebola, when core nations might not be aware that Ebola is still present in Liberia and make plans to travel to Liberia and unknowingly contract the disease and transmit Ebola back to their country. Thank you for watching this update on the latest on the Ebola outbreak.